Are you ready to be free? See life as it should be seen without the hassles of contacts and glasses? Christenbury Eye Center, the premier LASIK center of the Carolinas, is pleased to be the first clinic in the Southeast to offer intra-LASIK, all laser LASIK. Find out how intra-LASIK can change the quality of your life.
The Christenbury Eye Center is awesome. It was a wonderful experience.
Call 877-702-2020 today. When considering something as precious as your eyesight, you want one of the country's best, most qualified and experienced surgeons. You want Dr. Jonathan Christenbury. Dr. Christenbury has successfully performed over 35,000 LASIK procedures.
Since I've had intra-LASIK surgery, I can see things that I have never seen before.
Intra-LASIK has changed the way LASIK is performed. Call 877-702-2020 today. What's new in LASIK vision correction? Intra-LASIK, the first all-laser, all-computerized LASIK. Intra-LASIK is the safest, most accurate, and comfortable laser vision correction available in the world today and offered exclusively in the Carolinas at Christenbury Eye Center.
I would say that it was extraordinary. I mean, I can see now, and that's the greatest thing.
Call 877-702-2020 today. Dr. Christenbury calls it intra-LASIK. His patients call it a miracle, starting as low as $7.95 per eye. Call 877-702-2020 today. What's new in LASIK vision correction? Intra-LASIK, the first all-laser, all-computerized LASIK. Call 877-702-2020 today. Are you ready to be free? See life as it should be seen without the hassles of contacts and glasses? Christenbury Eye Center, the premier LASIK center of the Carolinas, is pleased to be the first clinic in the Southeast to offer intra-LASIK, all laser LASIK. Find out how intra-LASIK can change the quality of your life.
The Christenbury Eye Center is awesome. It was a wonderful experience.
Call 877-702-2020 today. When considering something as precious as your eyesight, you want one of the country's best, most qualified and experienced surgeons. You want Dr. Jonathan Christenbury. Dr. Christenbury has successfully performed over 35,000 LASIK procedures.
Since I've had intra-LASIK surgery, I can see things that I have never seen before.
Intra-LASIK has changed the way LASIK is performed. Call 877-702-2020 today. What's new in LASIK vision correction? Intra-LASIK, the first all-laser, all-computerized LASIK. Intra-LASIK is the safest, most accurate, and comfortable laser vision correction available in the world today and offered exclusively in the Carolinas at Christenbury Eye Center.
I would say that it was extraordinary. I mean, I can see now, and that's the greatest thing.
Call 877-702-2020 today. Welcome back for your one-day follow-up appointment after your Restore procedure. While you wait to see your doctor, let's review the instructed use of your medication drops. After your appointment today, it is important that you follow the guidelines for topical medications. 1 drop of Vigamox should be administered 3 times a day for 2 weeks following your Restore procedure. Then stop. You should use 1 drop of Econopred 4 times a day for 1 week following your Restore procedure. Taper down to 1 drop of Econopred 3 times a day for the following week, twice a day for the 3rd week, and once a day during week 4. After week 4, stop administering Econopred. 1 drop of Nevanac should be used 3 times a day for 4 weeks following your procedure. Then stop. Refill if needed. If your pharmacist substitutes Zybrome as a substitute for Nevanac, apply 1 drop of Zybrome twice a day for 4 weeks, starting the day of surgery. Then stop. Refill if needed. If your eyes are irritated or uncomfortable, you can use Cystane or any type of preservative-free artificial tears every 1 to 2 hours as necessary. It is important that you space different drops 5 to 10 minutes apart. Don't forget to wear the clear plastic shield at night for 1 week following your restore procedure. Do not throw the shield away. Remember, it is very important that you do not rub or squeeze your eye for a week following the restore procedure. You may use the lid scrub pads or a warm wet washcloth to gently wipe off crusts on the lids or lashes after surgery. You should also refrain from wearing eye makeup, swimming, and lifting objects heavier than 25 pounds for 1 week after your restore procedure. This information was provided in your post-operative canvas bag. Thank you for your patience. The doctor will be with you shortly. Are you ready to be free? See life as it should be seen, without the hassles of contacts and glasses? Welcome to Christenbury Eye Center, the Carolinas' premier center for great vision. Dr. Jonathan Christenbury, the chief surgeon, is pleased and excited to now provide wavefront-guided customized intraLASIK to his patients. As the most experienced intraLASIK surgeon in the world, Dr. Christenbury is always at the forefront of laser technology. He has personally performed over 50,000 LASIK procedures to date. Dr. Christenbury's focus is in providing outstanding patient care and the closest to 20/20 vision or better than 20/20 vision for every patient.
My wife and I did a lot of extensive research looking at different facilities across the country, and there's some wonderful places, but this seemed to be the facility to come to, and we came here, and as soon as we walked in the doors, we knew we were at the right place.
When I came to Christenbury Eye Center for my free screening appointment, the wavefront diagnostic that was done was very impressive to me. It actually showed, instead of taking an average of the point in my eyes, it took every point in my eye and was able to correct each point that was not right.
Wavefront technology measures subtle focusing abnormalities that are unique to every person's eye. We actually get a 3D image of that patient's focusing abnormalities. Each light ray is measured. And we can use that information to direct a customized treatment to try to make that patient better than 20/20.
The wavefront technology was extremely important to me because I've been having a lot of trouble driving at night because I saw the starburst, halos, glares, and the wavefront technology now is able to eliminate that. So I thought if I was a candidate, that would be a perfect fit for me.
With the old technology, we can correct nearsighted, farsighted astigmatism, but not high-order aberrations of the eye that cause poor vision and dim illumination or glare halos at night. Now with the wavefront technology, not only can we correct nearsighted, farsighted astigmatism, but we can correct those patients that have these complaints of poor vision and dim illumination or night vision.
With the wavefront technology, Dr. Christenbury was able to see a three-dimensional mapping of my entire eye, which allowed for a personalized correction of my vision.
When we use wavefront guided customized intraLASIK, we increase the percentage of patients that are 20/20 or better. With the old technology, maybe 85% of patients with 20/20 or better. Now 95% or more are 20/20 better, and majority of patients are even 20/15 better than 20/20.
Looking at a cost factor, since I invest money for a living for clients, obviously cost was important to me. So when I added up the costs of my contacts, my glasses, my sunglasses, it was actually quite exorbitant over a period of time. So I look at it, ran the numbers, and actually saved myself about $25,000 over a long period of time.
Being single and on a budget, sometimes it's hard to, pay for contacts and glasses, which are very expensive. And not only are you paying for the contacts, but the solution and constantly buying a lot of supply for that as well. And so I started doing a lot of evaluating and found out that LASIK eye surgery was going to benefit me more in the long run and cost less.
My goal for my patients is to provide excellence in care and in technology. I'm constantly adding the newest and the best technology to my practice to provide for my patients the best outcomes. more chance at 20/20, better night vision, and possibly seeing better than they did with their glasses or contact lens. One of the biggest differences at Christenbury Eye Center is that we have an excellent staff, highly trained, the best technology available, electronic medical records, and we're constantly trying to improve the service that we provide for our patients to give them the best patient experience as well as the best vision. I can't correct all my patients with one laser. People vary, their eyes vary in their cornea shape, their pupil size, corneal thickness, the amount of their correction. And we have to have a number of lasers to correct all our patients. I have 4 or 5 excimer lasers that do the vision correction, 3 lasers that do customized treatment, and we have all the diagnostic equipment to test patients. We have 2 of the interlaced lasers to make the corneal flap. We no longer use a blade in any process. There's no cutting involved. It's all laser technology. And that makes it safer. With all the technology, we actually remove probably 95% of the risk that have been there in the past with laser vision correction. Eye tracking is so critical in laser vision correction, and I think the accuracy of the procedure has been improved greatly when the FDA approved the eye trackers. We use eye trackers on all our lasers, and it's really critical the patient knows that if they are nervous or have trouble fixating on the fixation light during the procedure, it doesn't make any difference because the laser can follow their eye quicker than the eye can move. And what does that mean for the patient? With an eye tracker, the patient can relax and not worry. If their eye moves a little bit during the procedure, it doesn't matter. The interlays we now use, and I've done more interlays than anyone in the country. I have a tremendous amount of experience utilizing the laser to reduce the risk and also helping my patients feel comfortable about having laser vision correction. LASIK doesn't hurt. We give patients a little pill to make them relax, numbing drops. It takes about 10 minutes. People go home and rest the rest of the day. The next day, vision is good and eyes are comfortable. Patients use drops for a couple weeks. We prefer that patients have a companion to drive them home. Most patients can drive the next day. I really try to make the procedure affordable for our patients, and I think it is. And I think that anyone who wants laser vision correction can afford it. Many patients ask me, what's my likelihood of being 20/20? With a new customized wavefront guided intralasic, 95% or more are 20/20 or better, and many patients are 20/15. In general, patients are candidates if they're over 18 and their vision has been stable for 18 months, and we can confirm that by old medical records. There is no upper age limit, and majority of my patients are between 18 and 55 years old. I have patients that are over 60 that may have even had cataract surgery that are dependent on distance correction. We can perform LASIK on those patients often to get them out of glasses. I consider myself a student of technology and the visual sciences. I'm constantly looking at techniques or devices that may provide better outcomes for my patients. I'm constantly evaluating new techniques and technologies in my practice, and I want to offer the latest FDA-approved technologies that would give better outcomes for my patients.
Since I've had the wavefront guided customized intralasic, my life has changed essentially. It's so nice to be able to wake up in the morning and be able to see the clock. It's nice to be able to go out to events and not have to worry about contacts popping out of my eyes. It's nice to be able to golf and not have to worry about glasses falling off my head. It's just changed my life dramatically.
After my wavefront guided customized intralasic procedure, I'm now seeing 20/15.
After having my customized intralasic surgery, today my vision is 20/15, which is much better than what it was even wearing contacts or glasses, and I love it. I'm very, very happy with the vision that I have now.
If I were to describe my experience at Christenbury, it would be easy, convenient, fast, painless.
I would recommend Christenbury Eye Center to anybody, including my family, my friends. I would encourage them, if they have any kind of questions about their eyes, to come to Christenbury Eye Center. Let them take the opportunity to give you the eye exam. Let them assure you that whatever your problems are, they can fix, and whatever method needs to be done, because Christenbury knows his business.
You come to this facility, you're treated first class, everything's top shelf. They give you the service and the care that you need and a lot of people desire that you just don't get today. And everything's done with such a professionalism that you feel good when you come in and when you leave this place.
We hope you have enjoyed this presentation and that we have answered your questions as well as addressed your concerns. Please feel free to contact any member of our clinical staff should you need additional information about wavefront guided customized intra-LASIK or any of the other procedures performed here at Christenbury Eye Center. And thank you for your time today.